to another episode of the Spotlight on Food and Health Communications, your number one go-to media source for credible and timely health information. My name is Victor Waberry. Today on the Spotlight, we will be doing a subsection of the Spotlight, and we call this the Global Health Updates. It's a maiden edition, and we trust that you keep up the process with us as we bring to you every week updates from the health perspective around the globe. On my table this beautiful day, I've got so many health stories coming in for you. I've got the first one coming in from Asia, where we see that New Zealand fully reopens borders after COVID-19. And moving away from Asia, we will move to still in the health perspective. We see that first monkeypox death reported outside Africa. Stay with me as I tell you about that story. We also have in Europe, cancer survivor object to Spanish beach and image. And we also have in China, millions in Wuhan lockdown after 4 COVID cases. And moving to the United States, we see that Biden is positive for COVID after rebound infection. And to Mississippi, we see that there is a dangerous bacterium found in Mississippi soil. And also I've got for you, UK COVID cases have peaked and are now dropping. And also moving to Africa, and before going to Africa, I've got gestational diabetes is actually on the rise. And to Africa, we'll see that over 900 tuberculosis cases detected in Plateau state in Nigeria. And finally, in Africa, we'll see that 800,000 children living with HIV not on treatment, and that's coming in from the United Nations AIDS agency. For more on this, still me as I unfold this proceedings. I'll be right back after this break. Please do not stray. Welcome back. This is the Spotlight in Food and Health Communications, and today we are doing the Global Health Update. First off on my list, I've got New Zealand, who fully reopens border after COVID. And we understand that immigration authorities will now begin accepting, visitors with visas and those on students' visas again. The Prime Minister, Jacinda Ardern, called it an enormous moment, adding it was part of a cautious process. Let's hear what Jaden Ardern had to say.
We cannot keep border restrictions on forever, and to be absolutely clear, we don't want to do that either, and neither do the experts we talk to. Border closures were only ever a temporary measure in order to keep COVID out before a vaccine was developed and administered. That means the nature of your entry into New Zealand will be dependent on a couple of key things, in particular, your vaccination status and where you have been for the last 14 days.
We understand that most visitors will still need to be fully vaccinated, but there are no quarantine requirements. And the country's maritime border has also reopened, with cruise ships and foreign recreational yachts now allowed to dock. New Zealand first announced a phased reopening plan in February. It allowed vaccinated citizens to return from Australia that month and those coming from elsewhere to return in March. In May, it started welcoming tourists from more than 50 countries on a visa waiver list. And we, alongside the rest of the world, continue to manage a very live global pandemic while keeping our people safe, said Ms. Adrena in a speech at the China Business Summit in Auckland on Monday. Now, tourism was one of the industries hardest hit by the New Zealand tough COVID measures. In the year ending March 2021, the industry's contribution to the GDP dropped to 2.9% from 5.5% that year before. Now, international tourism took an especially big hit, plunging 91.5%, or 16.2 billion New Zealand dollars, according to the official data. The number of people directly employed in tourism also fell by over 72,000 during the period. And now, moving away from New Zealand, we understand that monkeypox first deaths outside Africa in Brazil and in Spain. A 41-year-old man in Brazil became the first fatality from the virus outside Africa. Spain announced 2 deaths soon afterwards, the first in Europe. Last week, the World Health Organization, WHO, declared the monkeypox outbreak a global health emergency. But infections are usually mild and the risk to the general population is low. On Friday, Brazil's health ministry said the victim there had suffered from lymphoma and a weakened immune system. A combo trait aggravated his condition. Brazil has so far reported 1,066 confirmed cases and 513 suspected cases of the virus. Data from Brazil's health ministry indicates that more than 98% of confirmed cases were in men who have had sex with men. Shortly afterwards, Spain's health ministry confirmed Europe's first deaths from the virus, a patient who suffered from the encephalitis. A second death linked to the monkeypox was confirmed by Spanish authorities on Saturday. And we understand that the health ministry said that 3,750 people, 3,750 monkeypox patients with available information, 120 or 3.2% had been hospitalized. Now, last week, World Health Director General Dr. Tedros Adhanom Ghebreyesus said declaring the outbreak a global health emergency would help speed up the development of vaccine and the implementation of measures to limit the spread of the virus. But he added, this is an outbreak. They can be stopped with the right strategies and the right groups. And we understand that the World Health Organization is issuing recommendations which it hopes will spur countries to take action to stop transmission of the virus and protect those most at risk. And away from Brazil to China, we understand that millions in lockdown in Wuhan have 4 cases. Now, almost 1 million people in the suburb of Wuhan, China, central city, where the coronavirus was first recorded, have been placed under lockdown. Now, Jiangxia district residents have been ordered to stay inside their homes or compounds for 3 days after 4 asymptomatic COVID cases were detected. China follows a zero-COVID strategy, including mass testing, strict isolation rules, and local lockdowns. This has resulted in far fewer deaths than in many other countries. But the strategy is facing growing oppositions as people and businesses continue to face the strain of restrictions. In Wuhan, a city of 12 million people, regular testing uncovered 2 asymptomatic cases 2 days ago. 2 more cases were found through contact tracing, and shortly after, the lockdown order was issued. Wuhan became known around the world in early 2020 as the first place scientists detected the new coronavirus and the first city to be put under harsh restrictive measures. At the time, the wider world was shocked by the strict lockdown, but many cities and countries were soon forced to impose their own similar measures. Later, China became known as a COVID success story, with restrictions lifted much earlier than in many other countries. But that has changed again, with China pursuing a zero-COVID strategy, resulting in frequent local lockdowns rather than trying to live with the virus as in most other countries. Now, away from Wuhan, China, we move to Mississippi, as we understand that dangerous bacterium is being found in the Mississippi soil. Now, the U.S. health officials says that they have found a rare but dangerous type of bacterium in soil and water samples in the Gulf Coast region of Mississippi. The bug, called Burkholderia, can make some people extremely sick if they become infected. Most healthy people who come in contact will not develop the serious illness called melioides, which can be treated with antibiotics. Medics are now on alert for any possible cases, and we understand that melioidosis can occur in people who have underlying diseases such as diabetes and chronic kidney disease. The United States Centers for Disease Control is advising residents who might be at higher risk to take precautions. And precautions such as number one, avoid contact with soil or muddy water when possible, particularly after heavy rains, and protect open wounds with waterproof dressing. Number two, wear waterproof boots when gardening or doing agricultural work. And number three, wear gloves to protect the hands when working directly with the soil. Now, it is unclear how long it has been in the environment and where else it might be found in the U.S. Worldwide, most cases are in people who live or have traveled to areas where the bacterium naturally occurs, such as parts of South and Southeast Asia and Northern Australia. Now, cases of melioidosis have also been linked to imported contaminated commercial products from disease-endemic countries. This happened in the United States in 2021 when a cluster of 4 cases in 4 states were linked to an important contaminated, aromatherapy spray. Now, health officials tested soil that water samples in and around both patient homes. 3 of the samples tested positive, suggesting the bacterium has been present in the area since at least 2020. Finally, melioidosis can cause symptoms like fever, joint pain, and headache, as well as lung problems, blood infection. Away from Mississippi, we move back to the United States as we hear that the United States President Joe Biden tests positive for COVID after a rebound in infection. The 79-year-old first contracted the virus on 21st of July when he was revealed to be experiencing mild symptoms. On Saturday, Mr. Biden said he was not experiencing symptoms but will isolate for the safety of everyone around me, according to his words. The president has tested negative for the virus 4 times before Tuesday and Friday last week. In a letter describing the situations, Mr. Biden's physician, Dr. Kevin O'Connor, said there was no need to resume treatments, but the president will remain under close observation. Mr. Biden has been taking Paxlovid and extraviral medicine, which the doctor said had led to a small percentage of COVID patients experiencing a rebound test. And that's one's coming in from the United States. And we just hope, the United States president, and we just hope that things get better, and we hope that he recovers fast from the COVID diseases allegedly found in him. Now, before we continue, we will go on a very quick break. When I come back, more stories coming up your way from the health perspective around the globe. Please stay with me. Welcome back. We're still discussing health updates around the world. Now we understand that gestational diabetes is on the rise. And quickly, here are nutrition tips to prevent and treat it. As we see that just last week, the Center for Disease Control and Prevention, CDC, pointed out a new study that there has been a 30% increase in gestational diabetes mellitus, otherwise known as GDM, the official term of gestational diabetes among women who gave birth between 2016 and 2022. The agency noted that the gestational diabetes rate has risen with increasing maternal age, body mass index prior to pregnancy, and plurality, meaning the number of live births per pregnancy, talking about twins, triplets, etc., keeps rising. The rates of gestational diabetes ranged from 4.7% in Mississippi to as high as 12.6% in Alaska in 2020, according to the CDC study. About 50% of women with gestational diabetes go on to develop type 2 diabetes, and that's coming in from the CDC. It also said that the rates of GDM varied by a modest race, with the highest rates in non-Hispanic Asians at 14.9% and lowest in non-Hispanic black women at 6.5% among the 6 largest rates and Hispanic origin groups studied, according to the recent reports released by the CDC. Now, in order to maintain a healthy a healthy lifestyle, in order not to contact the, gestational diabetes, a healthy weight is key. And the CDC encouraged women before they get pregnant to maintain a healthy weight by eating nutritious food and engaging in regular physical activity most days of the week, which can reduce the risk of development of GDP. And now moving on to Africa. In the African scene, we understand that over 900 tuberculosis cases have been detected in Plateau State quarterly. Just so sad. And we understand that the Breakthrough Action Nigeria, a non-governmental organization, says over 900 cases of tuberculosis are detected in Plateau quarterly. The state's coordinator of the organization, Dr. Catherine Igoho, stated this on Monday in Jos. The event was the commencement of the National Tuberculosis Testing Week. The data on new TB cases, Dr. Igoho said, was gotten from the hospitals and outreaches conducted in the state. She said that the week-long testing aimed to create awareness about TB and to also intensify cases findings. She said the aims was to also put those vulnerable to developing active TB on preventive treatment and prevent community spreading, adding that every undiagnosed and untreated cases could infect 15 people within the year. Similarly, Plateau Commissioner for Health, Dr. Nimkong Indam, said the essence of the week was to create a massive awareness of tuberculosis via community outreaches. Indam, who was represented by the Ministry Directors of Public Health, Dr. Mafaro Masuk, lamented that TB, which is preventable and curable disease, has led to the death and disability of so many persons. The areas include malaria intervention, tuberculosis, Lassa fever, yellow fever, and COVID-19. Finally, in Africa, we understand that 800,000 children are living with HIV and having no treatments whatsoever as regarding this. And this is coming from the UNAIDS. And so we understand that a new report released by the Joint United Nations Program on HIV/AIDS have revealed that treatment coverage among children living with HIV is poor. According to the report, globally, an estimated 800,000 children living with HIV do not receive treatment in 2021. The report, titled In Danger, launched by UNAIDS, showed that children living with HIV are often being left behind. The UNAIDS report indicates that every day 4,000 people, including 1,100 young people aged 15 to 24 years, become infected with HIV, and this is just so sad. The report warns that if current trends continues, 1.2 million people will be newly infected with HIV in 2025, which is 3 times more than 2025 targets of 3,700 cases new infections. The report notes that progress against HIV has slowed down since the COVID-19 pandemic, while lamenting that the human impact of the stalling progress on HIV is chilling. The report also revealed that in 2021, 650,000 people died of AIDS-related causes, amounting to 1 every minute. The UNAIDS reports pointed out that without accelerated action to prevent people from reaching advanced HIV/AIDS, AIDS-related causes will remain a leading cause of death in the world, especially in Africa. And this is where we let down the anchors on global health updates coming in around from various perspectives of the health sector. We hope you've learned a thing or two, you've been informed, and what's that area you've learned a thing or two or you've gotten informed about? The goal is that you get informed and stay healthy and stay away from all those diseases flying around at this time. For more, inquiries, if you've got comment sections, kindly drop it in the comment section. If you've got complaints wherever it is, or you want to reach out to us, the comment section is all yours. Do well to reach out to us, and we will do well to reach out to you. And lastly, don't forget to subscribe to our YouTube channel. You could also like our videos and go through other health videos that have been put out there for your health consumption. Till I come your way next time, my name is Victor Wabery. Do stay healthy.